Welcome to Milan, an international metropolis famous the world over and outward-looking in every sector, including science and medicine. At a short distance from the historical and beautiful Piazza del Duomo in Milan, you can find one of the centers belonging to the Istituto Auxologico Italiano.
Founded in 1958, Auxologico Research and Teaching Hospital provides top-quality facilities in Milano downtown and in Verbania Lake District. At the forefront of medical research, Auxologico works in partnership with the major faculties of medicine in Italy and with the most renowned research centers in the world. The goal of Auxologico is to combine clinical research, innovative medical equipment, and a highly professional healthcare team with the needs of the patients in prevention, acute care, and rehabilitation. Every single professional is focused on the patient. All our services are created to answer complex questions immediately and accurately. We provide the best solution for complex healthcare problems.
The Capitano Auxologico Center is a comfortable hospital unit staffed by highly qualified health personnel. It comes complete with excellent diagnostic, medical, surgical, and rehabilitative equipment.
We know that health is one of the most important issues, and it's quite normal to feel a little bit worried and nervous about that. So comfort, safety, and care of our patients is our top priority at all levels, at all time. We support all our patients with a comprehensive range of services, 24 hours a day, 7 days a week, from the first contact until they return home, and even more. We provide support for all kinds of needs, such as medical appointments, second opinion, complex surgery, advanced rehabilitation, and medical follow-up. As regards the organizational side, we provide assistance with admission and discharge procedures, assistance with insurance companies, and for international patients, we provide also assistance with traveling procedures and connection with the hospital, lodging arrangements for family members or companions, and language interpretation service. We proudly provide patients with personalized, confidential, and culturally sensitive service. Quality is our key successful factor, and it guarantees our commitment for best medical services. In few words, Auxologico offers to its patients highly experienced doctors, modern technology and medical equipment, very personalized service, and no waiting list.
In our surgical department, patients can find everything that today's modern technology has to offer. From the most sophisticated techniques of mini-invasive 3D surgery to robotic surgery and laser treatments. All this to satisfy our patients' utmost needs. Surgical success together with the mitigation and disappearance of post-op pain. The result reached are the outcome of the medical and nursing staff specific training, which finds its place in the hallowed tradition of Milan's University Surgical School.
So welcome to the orthopedic operation theatre. As we can see, the room is empty now because we are very severe in the prevention of infections. In the Istituto Auxologico Italiano, we perform approximately 600-700 arthroplasties a year. Our main topics are knee and hip surgery, arthroplasty, primarily, and revision. We also perform shoulder arthroplasty. We have the whole spectrum of arthroscopic surgery, knee, hip and shoulder. We do a lot of ligament reconstructions, surgery for menisci and cartilage pathologies. We do mainly the percutaneous correction of the forefoot in those years, and we perform the whole traumatologic pathologies. As I said, our main clinical topics are knee and hip surgery. We have a very good expertise in hip arthroplasty. We were one of the first groups that performed the anterior hip access, the bikini incision in Italy. We are experts in revision arthroplasty of the hip, where we treat revisions with a massive bone loss from all over Italy. So we still treat those with a very modern implants and massive bone grafts.
At our ophthalmology operative unit, all our patients' needs can be met by means of clinical, diagnostic, and surgical procedures. Surgery comprises each and every branch of ophthalmology, from cataracts, which are removed with ultrasounds and femtolaser, to vitreoretinal surgery, performed with mini-invasive 27, 25, 23 gauche techniques, to cornea surgery, carried out with piercing DSEC and DMEC transplant. We have also developed comprehensive surgery treatment of glaucoma with cutting-edge laser techniques, and we can deal with any orbital eyelid pathology. We are very well prepared when it comes to diagnostics. The medical retinal clinic features avant-garde instruments like fluorescein angiography, the angio-CT and the yellow laser. The glaucoma clinic, which employs the latest in computerized perimetral techniques, HRT and OCT of the optical nerve. The neuro-ophthalmology clinic, one of the most important centers in Italy, dedicated to every neurological pathology connected to ophthalmology.
The Department of Neurorehabilitation hosts about 50 inpatients and treats about 20 to 40 outpatients a day. Most of them suffer from diseases of the nervous system or from the sequelae of orthopedic interventions, mostly hip and knee replacement. All of our patients are post-acute. They come from acute events, usually from the main acute units in Milan, neurosurgery, neurology, intensive medicine. They stay about 25 to 60 days, depending on the severity of their disability. We have a multidisciplinary team, including physicians, nurses, occupational therapists, physical therapists, speech therapists, psychologists, and of course neuropsychologists. The patients suffer from the most various impairments, motor, cognitive, sphincterial, and they need a coordinated intervention. The key to success is not only coordinating these specialists, but also coordinating the care activity with research and teaching. We host the residents of the School of Specialization of the University of Milan, and we run several research programs, mostly based on the control of movement and on neuropsychological impairments. I think that this is the key of success, given the complexity of disability following the disorders of the nervous system.
L'Istituto Auxologico Italiano is a research institution which is between the 50 excellence hospital endorsed by the Italian Ministry of Health, and its Capitanio Polo is particularly devoted to surgical research and practical surgery, particularly in the fields of ophthalmology, of orthopedics and urology. As a research institution, Istituto Auxologico Italiano is on the forward of research and translation of research results into the medical practice. So the investigators of the Istituto Auxologico Italiano are participating in the greatest advances of medical research in the world. And of course, being investigator can easily receive the result of the other investigators and translating as soon as possible these great advances of research into the medical practice and the benefits of the patient.